Most men, when they first experience erectile dysfunction, feel confused about what to do next. Should you just book an appointment with your regular doctor, the one you've been seeing for years? Or should you go straight to a urologist, a specialist in men's health? The choice may seem small, but the truth is it could make the difference between simply covering up a symptom and uncovering a diagnosis that could save your life. Because erectile dysfunction isn't always about aging, stress, or a bad night of sleep. In many cases, it's your body's very first alarm bell, signaling hidden issues like heart disease, diabetes, hormone imbalance, or prostate problems. And ignoring that signal can be dangerous. What matters most is knowing who to trust with that alarm, because the right doctor doesn't just restore your confidence, they protect your future health. And in the next few minutes, we'll break down exactly who you should see and why it matters. When most men hear the term erectile dysfunction, they think it's just a problem of performance or aging. But the bigger picture is this. ED is rarely an isolated issue. It's often a reflection of what's happening in your blood vessels, your nervous system, your hormone levels, and even your prostate. Let's start with the heart. One of the most common hidden causes of ED is heart disease. When blood vessels become narrowed or hardened, blood flow is reduced. Because the arteries in the penis are smaller than those in the heart, ED can actually appear years before chest pain or a heart attack. Next is diabetes. High blood sugar quietly damages both the nerves and blood vessels required for normal erections. Many men don't discover they have diabetes until ED forces them to get checked. Then we have hormone imbalance, especially low testosterone. This doesn't just reduce sexual desire. It saps energy, weakens muscles, disturbs sleep, and can even impact mood and mental clarity. And finally, there are prostate issues. An enlarged prostate, chronic inflammation, or even early signs of prostate cancer can interfere with erections long before other symptoms appear. That's why doctors often say ED is often the first visible symptom of hidden conditions. It's not just about intimacy, it's your body's early warning system, and paying attention to it could save your health. When most men hear the term erectile dysfunction, they think it's just a problem of performance or aging. But the bigger picture is this. ED is rarely an isolated issue. It's often a reflection of what's happening in your blood vessels, your nervous system, your hormone levels, and even your prostate. Let's start with the heart. One of the most common hidden causes of ED is heart disease. When blood vessels become narrowed or hardened, blood flow is reduced. Because the arteries in the penis are smaller than those in the heart, ED can actually appear years before chest pain or a heart attack. Next is diabetes. High blood sugar quietly damages both the nerves and blood vessels required for normal erections. Many men don't discover they have diabetes until ED forces them to get checked. Then we have hormone imbalance, especially low testosterone. This doesn't just reduce sexual desire. It saps energy, weakens muscles, disturbs sleep, and can even impact mood and mental clarity. And finally, there are prostate issues. An enlarged prostate, chronic inflammation, or even early signs of prostate cancer can interfere with erections long before other symptoms appear. That's why doctors often say ED is often the first visible symptom of hidden conditions. It's not just about intimacy, it's your body's early warning system, and paying attention to it could save your health. For most men, the first step when dealing with erectile dysfunction is to see their general doctor, and that's understandable. A general practitioner is easy to access, usually less expensive, and can provide a broad overview of your health. They can take your medical history, ask about your lifestyle, and review any current medications that might contribute to ED. In some cases, they may even prescribe drugs like Viagra or Cialis to help improve erections in the short term. This makes the general doctor a good starting point, especially if you've never discussed ED with anyone before. They can provide reassurance, check for common risk factors, and begin addressing the issue. But here's the limitation. A general doctor usually doesn't go deep enough to uncover the root cause. Their focus is often on treating the symptom, helping you perform better, rather than investigating why the problem started in the first place. Most general doctors don't run specialized hormone tests. They don't perform detailed blood flow studies, and they typically don't examine the prostate unless there are obvious symptoms. That means serious conditions like cardiovascular disease, diabetes-related nerve damage, or early prostate cancer can go undetected. As experts often put it, a general doctor often treats the symptom but may miss the disease behind it. And that's why knowing when to go beyond a general doctor and see a specialist is so important for men over 50. Now let's talk about the urologist, the true specialist when it comes to men's health. Unlike a general doctor who focuses on overall wellness, a urologist is trained specifically in the urinary tract, the prostate, male hormones, and the blood vessels and nerves that make sexual function possible. This deeper expertise allows them to investigate erectile dysfunction far beyond surface-level symptoms. For example, they can perform hormone testing, not just checking testosterone, but also prolactin, thyroid hormones, and other markers that can quietly affect sexual health. They can conduct a prostate exam, which is critical for detecting enlargement or even the earliest stages of prostate cancer, long before other symptoms appear. They also have access to tools like the ultrasound blood flow test, which uses Doppler imaging to see if your arteries are delivering enough blood to the penis or if blockages are restricting flow. On top of that, they can carry out nerve evaluations, an important step for men with diabetes, Parkinson's disease, or a history of spinal injury, where subtle nerve damage can be the hidden cause of ED. And don't forget the role of medications. A urologist knows which common prescriptions, like those for high blood pressure, heart disease, or depression, may trigger ED. Through a medication review, they can often adjust your treatment plan to reduce side effects without compromising your overall health. Most importantly, a urologist doesn't rely on a one-size-fits-all solution. They create a personalized treatment plan, which might include targeted medication, hormone therapy, lifestyle changes, or in some cases, advanced procedures or surgery. The goal is not just to restore performance temporarily, but to fix the underlying issue and protect long-term health. That's why specialists emphasize, a urologist doesn't just give you a pill, they find the root cause and fix it. For many men, that difference is life-changing. So the big question is, who should you see first when erectile dysfunction shows up? If you're just starting to notice symptoms, maybe occasional difficulty maintaining an erection, or you're unsure if it's stress, lack of sleep, or a side effect of medication, then beginning with your general doctor makes sense. They can do a basic evaluation, review your medical history, and rule out simple, obvious causes. For many men, this first step provides reassurance and a clearer picture of overall health. But if the problem persists, if ED continues for weeks or months, or if it comes with other warning signs like constant fatigue, difficulty urinating, disturbed sleep, high blood pressure, or diabetes, then it's time to see a urologist immediately. That's because ED in these situations is much more likely to be connected to deeper issues such as cardiovascular disease, hormonal imbalance, or prostate disorders. In simple terms, your general doctor is the starting point, the first checkpoint. But the urologist is where you go to uncover the root cause and build a personalized treatment plan that protects your long-term health. Remember, ED isn't just about performance. It's your body sending you a message. Choosing the right doctor at the right time can make all the difference. When you choose to see a urologist for erectile dysfunction, the benefits go far beyond intimacy. You're actually protecting your entire health. First, you can protect your heart. Because ED is often linked to blocked arteries, a urologist can detect early signs of cardiovascular disease, sometimes years before a heart attack. Second, you can prevent diabetes complications. By managing blood sugar and protecting blood vessels and nerves, a urologist helps stop ED from getting worse and protects your long-term health. Third, you can balance your hormones. Restoring testosterone and other hormone levels improves not only your sexual health, but also your energy, your sleep, and even your mood. Fourth, you gain better prostate health. Regular exams with a urologist can detect prostate enlargement or even cancer at a stage when treatment is far more effective. And finally, it's about quality of life. By treating ED at the root, you don't just regain confidence in the bedroom, you gain strength, vitality, and peace of mind in everyday life. That's why experts say, when you treat ED with a urologist, you're not just treating a problem, You're investing in your future health. Men, if you're over 50 and struggling with erectile dysfunction, this is not the time to stay silent. Don't ignore it. Don't just cover it up with quick fixes you find online. ED is more than a bedroom issue. It's your body sending you an urgent message. And the right doctor is the one who can help you decode it. If you feel uncertain, start with your general doctor. That can be a good first step. But don't stop there. A urologist has the specialized training and tools to uncover the hidden causes, whether it's your heart, your hormones, your prostate, or your blood vessels. They don't just treat the symptom. They protect your health, restore your confidence, and give you back control over your future. So take action today. Make the appointment, get tested, get the answers you need, because protecting your health, your relationships, and your future is worth so much more than pretending nothing is wrong.